Welcome to San Diego's most popular local morning news. Good morning, San Diego.
We'll get to Joe in a minute.
Yes, we will. Good morning, everybody. I'm Sandra Moss.
And I'm Dan Plant. Today is Thursday, October 30th.
Breast cancer is the leading cause of death for women ages 20 to 59, but still a majority of women are unaware of whether they're at risk for the disease. Well, now there's a new test. It's called the Halo Pap test that might be able to help. Dr. Robin Wedberg and Halo patient Megan Mansfield are here today to tell us all about it. Welcome.
Thank you.
All right, we all have heard of the Pap test that detects cervical cancer. Why do they call this Halo test a breast Pap test?
Good question. Because unlike mammograms, which are radiologic tests, this is a microscopic cellular test. So the cells are looked at under the microscope, much like the Pap test is done.
All right, you brought this contraption here. We're going to get a picture of it over here. And explain to us, Dr. Wedberg, how this works.
There are two cups.
Okay.
This is a fully automated machine. The entire process takes 5 minutes. The cups are attached to the breasts, and using warmth, gentle massage, gentle suction, the attempt is to see if there are any cells in the ducts which can be brought out to the surface.
So it
and sent
extracts
to the
liquid,
lab.
fluid.
Yes, within which are cells, breast cells.
So for most women that take this test, is there fluid that actually is extracted?
About 50% of the time there is.
And then what happens?
If there is cell extracted, then that is sent to the lab, and the pathologist looks at it under the microscope to see if the cells are normal or atypical.
And if they're atypical, then what?
Atypical cells would put the patient into a more high-risk category, and therefore she'd be more at risk for developing breast cancer over her lifetime.
Now, Megan, you took the test not too long ago. This looks a little archaic to me. How did it feel, and what was it like?
You know, it took, like she said, about 5 minutes, and it felt actually good. I mean, it felt like, you know, my breasts were getting massaged, and, you know, it was warm and
It
gentle.
wasn't painful?
No, not at all.
And how'd your test come out?
Negative 2 years in a row.
Oh, that's good. Now, are they recommending that you have this every year in addition to a mammogram? How does this work, doctor?
Yes, it is not instead of a mammogram, at least not now. But it's something we'd like to suggest to patients once a year as part of their gynecologic annual exam.
So it's really just kind of something that is a backup therapy that gives you peace of mind? Is that what we're talking here?
It's an extra layer of safety, I like to call it.
And who do you recommend take this test?
We offer it for women between 25 and 55, although we do offer it also to women in their 60s if they would like it.
Now, because this is a relatively new test, is this covered by insurance?
No, it isn't yet. We hope it will be.
And how much does it cost, typically?
$80 to have the procedure done. If there is a specimen to be sent into the lab, then insurance usually covers that portion, and then it's about $120.
Lifesaver in the end?
I think it very much is a lifesaver.
Because it's what, finding early cancers?
Yes, if we can detect the women who are at higher risk for breast cancer, we can accelerate their surveillance over the rest of their lifetime to pick up cancer early if it does develop.
Dr. Robin Wedberg and Megan Mansfield, thanks so much for your time today. Appreciate it.
Thank you very much.
It's always good to learn about something new.